Hi, this is Beth with a very important What Matters More and that I want you all to really watch and pay attention to. I'm with Christa Shifflett of the Warren Coalition, and she has some sobering statistics to share and some really enlightening information about addiction. All of us know people that struggle, and she's really working hard to change the stigma of addiction and to give people hope that there is a chance. It can happen to anyone. So please watch and learn from Christa Shifflett.
Thanks so much for having me, Beth. I'm here because obviously we all know we have been fighting the COVID pandemic and doing what's necessary to try to prevent its spread. But because we've been so focused on that, what we've sort of swept under the rug is that there still is an opiate epidemic sweeping our country. And I wanted to sort of come and touch on that. We've seen a huge increase in overdoses with opiates, even here in Warren County. Last year we had 85 overdoses for the whole year in the emergency room. So far this year we have had 101. That's mid-May statistics. So people are suffering. Isolation is a really big cause of relapse for people who have opiate use disorders or alcohol use disorders, and that's what they're being asked to do. There have been big studies that indicate that people, even on alcohol, their alcohol use has increased. Alcohol sales in March across the board increased 55%. Drizzly, an online wine club, reported that their memberships increased 578% in the month of March. And retailers who have on sales are now reporting their off sales going through the roof. So this isn't just about opiates. People need to be paying attention to their consumption, and some people, especially people who are struggling with anxiety and depression, having trouble coping with what's going on, are reporting a large increase of use, and we're concerned that substance use disorders will be on the rise because of this. Trauma is one of the biggest causes of people using substances, and the trauma from this pandemic is going to be long lasting. So we really need to pay attention around us. If you are struggling, if you think, oh, well, ask me about my drinking, are we talking about pre-COVID, or are we talking about now? And you're having those thoughts, there are places that can help you. There are online meetings. Northwestern Community Services is doing services online, and if you feel like you have a friend or a relative who may be in that place, reach out and tell them there is support available. And on the side for opiates, I just want to talk about that for a minute, because people assume that there's something wrong with the people who have become addicted to an opiate, and there's something bad about them in many cases. And with this drug, that is not the case. There are three types of people when it comes to opiates. There are people who take them and hate them and can't stand them and want nothing to do with them. There's a second group of people who get a little euphoria when it happens, and then that's gone. And there's a third group of people who have taken opiate, even if it's given to you by a doctor in the hospital after surgery, and are falling in love. And it is the biggest, most life-changing experience. They are euphoric, they love how it feels, and their brain has become instantly addicted. And that is genetic. In many cases, there's actually a genetic test out now that can be done to see if you have the gene that puts you at risk to becoming addicted if they give you an opiate. And we're talking about three groups of people, so your chances are around 1 in 3 that perhaps you have this gene. So the assumptions that happen around that keep people from getting help. It's very stigmatized. People feel shame when they're out of control, and we need to work on reducing that stigma. And some of the way we can do that easily to begin with is think about the language that you use. If you are talking about someone who is struggling with the disease of addiction and you're calling them an addict, how many people out there associate that with good things? And would you want people to be labeling you with names that aren't good things, particularly when you have a disease? We do not describe people with cancer as a cancerous person. They are someone who has cancer. Just like if you said, someone was struggling with the disease of addiction, you would say, this is someone who struggles with a alcohol use disorder. This gives it a medical term. This makes it in human terms. It's not judging. It's perceived as a disorder. And I just read a study, very interestingly. They did a study of 500 clinicians, mental health workers, 65% of whom had PhDs, and they gave them case studies. And in the case study, it was the same person, but in one, they described the person as someone who had a substance use disorder, and in the other, they described him as a substance abuser. When they scored them, the clinicians who had the substance abuser recommended more punishment than those who didn't have that term for that person and made it their fault, versus the person who was ill, they recommended more treatments and things to support them. So as we go through this, the opiate epidemic has not gone away. Please be thinking, am I supporting people who could potentially be struggling? And it doesn't just have to be opiates. The isolation is out there. Reach out to people. Let them know you're there. Even if you can't do it in person, support them. And try to think about that one little thing you can do. Beth does What Matters, and I'm here to tell you words matter. So if you want more information on People First language around the disease of addiction and how you can help be a supporter for people who are in recovery and encourage people to get out there and seek the help they need so they can be the best version of themselves, please feel free to reach out to the Warren Coalition, and I would be happy to provide that information to you or any groups that you think would be interested in talks on understanding exactly what goes wrong in the brain for people who do struggle with this disease and what you can do to help support them. Thank you for listening.